my students, welcome back. Okay, so today we're going to be talking about the dentist. I recently went to my dentist and thought, this might make for a great video. You're going to learn vocabulary, phrases, things that the dentist might say to you, and even a silly conversation between a patient and a dentist. So let's get started. I went to my dentist recently. The first thing I did was check in at the reception desk. This is called the reception desk. And here I'm checking in. This is the reception area, and this is the waiting room. There are 3 important jobs at a dentist: the dental assistant, the dental hygienist, and the dentist. In most offices, we say receptionist or secretary, but in a dental office, we would call her the dental assistant. This is called an exam room, and they usually have a number like exam room 1, exam room 2. This is exam room 2. Make an appointment. I need to make an appointment. I need to make an appointment. Checkup. I'd like a checkup. I'd like a checkup. Teeth cleaned. I need to have my teeth cleaned. I need to have my teeth cleaned. Polish teeth. We're going to polish your teeth. We're gonna polish your teeth. We're going to polish your teeth. We're gonna polish your teeth. Chipped tooth. I have a chipped tooth. I have a chipped tooth. Crown. I lost a crown. I lost a crown. Veneers. I'd like to know how much veneers cost. I'd like to know how much veneers cost. How much are veneers? How much are veneers? Composite resin. Amalgam. Porcelain. Gold. Filling. I need a filling. I need a filling. My filling fell out. My filling fell out. Whiten. Whiten. I'd like to whiten my teeth. 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 False teeth. I don't want false teeth. I don't want false teeth. Implant. The dentist will put in an implant. The dentist will put in an implant. They took x-rays of my teeth. They took x-rays of my teeth. Now we're going to practice things that your dentist might ask you to do. Open. Open wide. Open wide. Move your tongue back. Move your tongue back. Bite down. Bite down. Don't move. Don't move. Stay still. Open. Open wide. Move your tongue back. Bite down. Stay still. Don't move. Rinse. Okay, you can rinse now. Okay, you can rinse now. Here are some things that you need or might need. Toothpaste and a toothbrush. Toothpaste and a toothbrush. Mouthwash. Mouthwash. Novocaine. Novocaine. Braces. Braces. Invisible braces. Invisible braces. These invisible braces are called Invisalign, and I went to my dentist to see if I could get some invisible braces for my bottom teeth. But they were quite expensive, so I guess I'm just going to have to live with some crooked teeth.
Hi, Dr. Smith.
So, what seems to be the problem today?
Well, I just came in for a checkup and a dental cleaning.
Okay, let's take a look. Open wide. Well, besides a lot of plaque buildup, it looks like there's a small cavity in one of your molars. Have you had any pain in this tooth?
It only bothers me when I drink something cold. Does it look bad?
Well, let's take an x-ray and see what we've got. I want you to bite down on this. Open. Okay, bite down. Now stay very still. Don't move. Okay, done. Well, the good news is we don't have to extract it. The decay isn't extensive enough. You can set up an appointment so we can fill it. It looks like the crown I put on last year is good.
Will you be able to give me nitrous oxide or something to dull the pain when you fill my tooth?
You'll only need a local anesthetic to minimize the discomfort.
Okay. I was hoping for the laughing gas.
We really don't offer nitrous oxide anymore. We also don't use amalgam fillings. I'll be putting in a porcelain one.
I prefer porcelain because you can't see it.
That's right. Well, you're done for today. Mary will help you set up the appointment.
Thanks, Dr. Smith.
You're welcome. Bye. When you're done with your appointment, you go back to the reception area and make another appointment in 6 months. Or maybe sooner, if that's necessary. Will you be paying with cash or card? Will you be paying with cash or card? Before the debit card, we used to say, would you like to pay with check, cash, or card? We don't use checks anymore, and we have 2 kinds of cards, debit and charge. So now you'll hear, do you want to pay by cash or card? I wanted to correct my bottom teeth because they're a little crooked, but invisible braces are expensive. So you're going to have to deal with my crooked face. I do. My crooked face? I said crooked face? I have a crooked face. Well, my students, that's it for this video. I hope you found it useful and more confident in case you have to go to the dentist and speak in English. And don't forget to ring the bell because I have more videos coming and I'll be here next week. I hope you will too. Bye.